My name is Dr. William Kevin Kelly. I'm a professor of medical oncology and urology at Thomas Jefferson University and the Sidney Kimmel Cancer Center. Again, I just want to give you some highlights from ASCO 2021 about prostate cancer and what was exciting this year. I think one of the areas that was highly anticipated was the reporting of the VISION trial, which was a phase 3 trial of lutetium-177 PSMA 617 in patients with metastatic castrate-resistant prostate cancer, presented by Morse and colleagues. Again, is that we know that PSMA is a molecular target and it's a transmembrane carboxypeptidase, and it's highly expressed on prostate cancer and relatively restricted to normal expression. And it's an excellent target for PET imaging, but this trial looked at lutetium-177, which is PSMA radioligand, which targets PSMA positive cells in the microenvironment, delivering a beta particle. Again, is that this was an open label study that actually looked at standard of care. Standard of care was defined as any therapy excluding chemotherapy, immunotherapy, or radium-223 versus lutetium-177 PSMA 617 plus standard of care. And again, is that the primary endpoint of the study was really look at radiographic progression-free survival and overall survival. They looked at other secondary endpoints, including time to symptomatic skeletal events, RECIST criteria, safety and tolerability, and other biomarkers. The bottom line is that around 87% of the patients had a PSMA positive skin, which was one of the requirements to get in there. And patients were randomized to standard care plus or minus radium-223, PSMA, lutetium PSMA. The outcomes were actually very impressive. You know, there was a prolonged overall survival for lutetium-177 plus standard care versus standard care. And again, it was overall survival was 15.3 months versus 11.3 months. The other endpoint of progression-free survival also favored the PSMA lutetium-177 PSMA 617. So overall, this is a very active agent in prostate cancer. However, one of the criticisms of the study is really what they took as the standard of care arm. Again, it was typically an AR-directed therapy. And as we know from other trials, such as the CARD trial, which showed the superiority of cabazitaxel versus second-line AR-directed therapy. Remember, cabazitaxel in that trial improved survival, improved progression-free survival, and also improved quality of life compared to AR-directed therapy. So the real question about the PSMA is how it is really going to compare to some of the other standard therapies that we use in second and third line prostate cancer, such as radium-223 or cabazitaxel. But still, this is a very active agent, and we look forward to using it in the clinic and seeing how we can utilize it best. The other abstract that was actually very interesting and presented was a phase 3 trial of a 2x2 factorial design of abiraterone, acetate plus prednisone, plus or minus local radiotherapy by Fazazi et al. This was called the PEACE 1 trial. Again, it was a very complicated trial, but basically what it looked at is standard of care, which was defined as standard of care was defined as androgen deprivation therapy plus minus docetaxel versus the experiment arm was standard of care plus abiraterone plus or minus a radiotherapy of the prostate. Again, is that they showed that there was no interaction of the radiotherapy to the systemic therapy. So they actually combined all the radiotherapy arms together. So they're really comparing the two systemic therapies. And When they actually did that is they showed that for the overall population, there was a marked improvement in overall progression-free survival of almost 2.3 years compared just to standard care alone. So there's a significant advantage for the triplet combination noted here. Again, it said what's not pending right now is overall survival, and we'll hopefully see that soon. Again, it said, how does this compare to other therapies out there? Again, it said Enzamet was reported a few years ago. Again, it said 45% of these were treated with docetaxel also concurrently, similar to in the Peace 1 trial. There was improved radiographic progression-free survival, but there was no overall change in overall survival. So it's very important that we actually see if this is actually going to translate into overall survival. Another abstract that was presented was the SWOG S1216 trial, which was a randomized trial comparing androgen deprivation in TAC-700 or Ortonel plus ADT plus bicalutamide in newly diagnosed metastatic hormone-sensitive prostate cancer. Well, the bottom line is they randomized patients between LHRH agonist plus TAC-700 versus LHRH agonist plus bicalutamide. And the results showed that there was improvement in progression-free survival, 47.6 months versus 23 months, but no improvement in overall survival. Survival. But I think the big point coming from this trial here was the overall survival in control arm was 70.2 months, which really shows is that our landscape for metastatic hormone-sensitive prostate cancer has changed and really set a new bar, which we have to really compare to in the future. And it's very hard to compare these trials across different populations, and we need to be careful about that. The other trial that was actually drove home a very important point for practicing physicians is the use of mandating bone protecting agents. Again, the Peace 3 trial was also presented, which was a randomized trial that looked at enzalutamide versus radium-223 versus enzalutamide. And they looked at the use of bone health agents during the treatment. Again, is that we know from the EORTC 233 trial, excuse me, the 223 trial is that there was increased fractures without the use of bone protecting agents. Thus, a urgent letter came out when this trial was around halfway through. They showed after the urgent safety letter that they could decrease they increased the number of patients that actually got bone protecting agents during treatment. But I think that the take-home message of this is that 1 year, if you actually use bone protecting agents, fracture rate decreases just with enzalutamide from 15.6 to 2.6%. And in the combination arm, it decreased it from 37.1% to 2.7%. So remarkable, and really gives the importance of why we need to use bone protecting agents in men with castrate-resistant prostate cancer. So those are my highlights for this year's ASCO 2021. I appreciate everybody listening.